Let me say something that might surprise you. I've learned as much from watching clinicians as I have from walking with patients. And I believe the same could be true in reverse. Chaplains and clinicians often operate in parallel, but rarely in partnership. We consult, we chart, we pass in the hallway, but what if we paused long enough to learn from one another? There's something sacred that chaplains bring to healthcare spaces that isn't always taught in medical school. We don't rush towards solutions, we hold space for presence. We don't assess symptoms, we listen for meaning. We're trained to sit with sorrow without needing to fix it, and that's something clinicians can learn. Because there's a quiet truth about healing that we don't always acknowledge. People don't just want answers. They want to be seen, heard, held in their humanity. You may not have time for a full pastoral visit, and that's okay. But small moments of connection can make a big impact. A pause before entering a room, a question like, what matters most to you right now? A simple acknowledgement that this is hard. I see that. That's spiritual care. And it's not just a chaplain's job. You don't need a collar or a title to show compassion. You don't have to be trained in theology to practice sacred listening. You just need to be willing to slow down, if only for a breath, and let your care reflect more than just protocol. Some things chaplains can teach clinicians: how to recognize spiritual distress, how to use silence without fear, how to validate emotion without making promises, how to respect belief without assuming agreement. And some things clinicians remind chaplains: that truth-telling is an act of kindness, that science and faith don't have to fight for the same space, that healing happens on more than one level, and we all play a part. When we stop working beside each other and start learning from each other, something changes. We create a culture of care that isn't divided by role, but united in purpose. Whole person care only happens when mind, body, and spirit are all acknowledged. The truth is, none of us can do this alone. So if you're a clinician, I invite you to learn from the chaplains around you, not just about what we do, but about how we see. And if you're a chaplain, don't be afraid to speak up. Your perspective matters, because when medicine learns from faith and faith respects science, that's when true healing begins. I'm Dr. Peggi Trusty, and this is where medicine meets faith. Stay rooted, stay ready, and stay well.